Hello and welcome to our special session on penile implants. Today we are joined by three distinguished experts in the field of urology who have made significant contributions to the advancement of urological prosthetics and men's sexual health. First, we have Dr. Paul Perito from the USA. Dr. Perito, based in Coral Gables, Florida, is one of the leading experts in penile implant surgery and men's sexual health, renowned for minimally invasive techniques and global training programs. Next, joining us from Australia is Dr. Christopher Love. Dr. Love is one of Australia's most experienced urological surgeons, specializing in penile implants and Peyronie's disease. He is regarded as a leading national expert in the field of prosthetic urology. Lastly, we are honored to have Dr. Mohammad Hamdan from Jordan. Dr. Hamdan is a distinguished urologist and high-volume implanter in Jordan, renowned for his expertise in male sexual health and urological surgeries, contributing significantly to advancing urological practices in the region. Thank you all for joining us today. To start our discussion, let's address some of the key questions that patients often have about penile implants. Dr. Perito, could you explain how patients might determine if they are suitable candidates for a penile implant?
So the definition of erectile dysfunction is the inability to obtain or maintain an erection to the satisfaction of both you and your partner. But when you're not getting morning erections, that's a little clue that something is not right. And then you'll see guys that start to fail pills. And, the ones that fail pills, at least 80% of them have a process called veno-occlusive disease, whether they're 20, I've operated on 6 20-year-olds, or 95. And this is like blowing air into a balloon that's got a hole in it. But what really brings people to all three of our offices is when they're tired of gambling. If you play craps, you don't roll 11 every single time. And once it gets to 49%, and a guy wants something that's 100% guarantee of a penetrating penis, that's when they move to get a penile implant. So that's what I believe is who's a candidate? Those guys that are failing pills, those guys that are, not getting morning erections and not being able to obtain or maintain that erection.
Thank you, Dr. Perito. Yes, thank you, Dr. Perito. Dr. Love, can you walk us through whether penile implants have any impact on orgasm or ejaculation?
So a penile implant is a great way for a patient to get an erection. A penile implant is a great way for a patient to get an erection when other methods fail, and it achieves a very good erection status. If the patient's able to have orgasm and ejaculation, depending on their other medical conditions, then a penile implant will not impact on that. Certainly should not make things any worse than they are, and indeed in some men possibly enhances the orgasm because the man now has a guaranteed erection, and it takes away some of the concern and anxiety he may have about being able to obtain an erection. But realistically, what I always say to patients is that this is a great way to be able to have a good erection, have penetrative sex, and all the other aspects of sexual behaviour, touch of the feel of the penis, sensation, warmth, all those things are exactly as before.
Thank you, Dr. Love. Dr. Hamdan, could you discuss how a penile implant might affect the length and girth of a patient's penis?
Well, after doing a penile prosthesis, especially with the new devices that provided by implants company, most of them are increasing the girth, and some of them increasing the girth and the length of the penis. But the patient must know that this result won't have it immediately after the surgery. He has to cycle his implant for many months to get increasing girth, and sometimes a little bit increase in girth. And I always tell my patient, every year with a erectile dysfunction, you will have decrease in your penile length. So sooner of treatment, the better of the result of the surgery.
Yeah.
Thank you. Dr. Hamdan, Dr. Perito, one common concern is whether a partner will notice the implant and how it might affect their sexual relationship. Can you shed some light on this?
Yeah. My wife and I were reading these questions. This one made us giggle because, how's it going to affect your life? I have one of my patients that calls him the 0 mile patient. He had his engine taken out, had a 351 Windsor put in, and he's back on the racetrack. So you're going from 0 to 100, at least when it comes to a penetrating penis. And then the thing that, especially if they're single and they're in the dating field, they're worried about having an implant where, they realize that they're pumping and, there's all different things that you can, tell them to describe why they might have a pump in their scrotum. But in the end, when you're able to accomplish what you can with the penile implant, I don't think partners really care that much. But the one thing that absolutely has to be done, and this is something that Dr. Goldstein really has driven into all of us, the mantra that the partner has to be ready too. So if it's a female and she's, pre-menopausal, menopausal, or postmenopausal, you want to make sure that they're ready. So if both partners are involved in it, in the long run, it's only a positive outcome. And as long as they're prepared and have set proper expectations, going back to the length and girth, that the only thing that's happening while you're experiencing erectile dysfunction is atrophy of your penis. And the only thing that stops it is a penile implant. So I think partners that work together on this, they're your happiest patients.
Thank you. Dr. Love, what should patients expect in terms of recovery time following penile implant surgery?
Look, I think there's some variability in patients' recovery, as there is with all surgical procedures. Typically, a penile implant patient in Australia would be in hospital one night after the procedure. They would be uncomfortable enough to not be doing much physical activity for the first 2 to 3 days, and reasonably comfortable in doing gentle physical activity by the end of the first 10 days or 2 weeks, and more or less okay after that. Certainly, I think most patients are uncomfortable in terms of pumping their device before 4 weeks, even though we encourage them to try and do so. But I think if you set the expectation that they have approximately a week of restricted activity, approximately a week of light activities, and then move on from there, and encouragement to inflate the implant as soon as they can. But realistically, I think 4 weeks is when most of the patients are comfortable to do so.
Thank you, Dr. Love. Dr. Hamdan, could you provide some guidelines on how patients should prepare for a penile implant?
Well, first, they should go to their physician or surgeon to tell them what to do before the implant. But basically, usually their doctor will check their blood sugar level and will do some tests like urine samples and, some blood tests to make sure that there is nothing to prevent the surgery. And if he's taking, blood thinners, some doctors will advise them to stop the blood thinners a few days before the surgery. And, some guidelines will advise the patient to do a specific washing material before the night of the surgery. And basically that's it. It's a 1 day procedure. It's less than 1 hour surgery. It doesn't need a special preparation for it, other than the thing I said.
Thank you, Dr. Hamdan. Dr. Perito, are there different types of penile implants available? And can patients choose the type they receive based on their specific needs?
Well, of course, patients can choose. And hopefully, going back, Dr. Hamdan, to how to prepare, you prepare by going to a dedicated center, right? They need to find people like you, Dr. Love. Yeah, and once they find people like that, then they will have somebody with the fund of knowledge to describe the 3 implants that are available. It's the only triopoly, in surgical devices. So, they need to be able to, have all of the specifications of each implant and decide, which one is going to be best for that anatomy, that patient's dexterity. So they have the entire realm. There's malleables, which you bend them up, you bend them down, but they're not physiologic, but they're great for guys with dexterity issues. They're great for guys that might get a little, confused. There's inflatables, and there's inflatables with different size cylinders. And if you have a dedicated center, which I'm sure, guys, 75% of implants are put in by people that do less than 10 a year. That terrifies me. Absolutely terrifies me. And that's one of the reasons that, we haven't seen this giant, exponential increase in penile implants across the globe. But if you go to a dedicated center, they're going to give you every single option, and they should be well versed in it. And, that's something that, we're trying to do, across the globe with Society of Prosthetic Surgeons, which I know these guys are members of. So, there's an implant for everybody, and hopefully you go to a dedicated center, and that man or woman will be capable of, being well versed in, which implant is for you, brother. Got it?
Thank you. That's perfect. Dr. Love, can you explain how a penile implant might affect the appearance and feel of the penis?
So it depends a little bit on the type of implant, as Dr. Perito was just alluding to. But if we're talking about a 3-piece inflatable implant, essentially you would expect that to give a very good hard erection. In fact, in some devices, it's harder than a real erection. But the penis will look full, it will have good girth, it will be very rigid. The head of the penis, the glands of the penis, doesn't fill by inflating a penile implant, and that needs to be explained to men because they sometimes get a little concerned about the appearance and indeed the length of their erection, because they're used to looking down and seeing an erection that's both the shaft and the head filled. So the head will engorge to some extent in a fair number of these men with sexual stimulation, but the implant itself doesn't fill the glands. So that's important to tell them. But otherwise, an inflated implant looks like a really good, solid erection, and somebody looking at that man would really not be able to tell any different. When they're deflated, the common thing with inflatable implants deflated is the length of the implant stays the same, even though it's deflated. So the penis won't retract into the body as it used to. And the penis will never be quite as flaccid with an implant in place as it was previously. Some implants are made of material that's rather thick-walled and tends to create some creases or folds in the penis when it's deflated. Other brands are more natural when they're deflated because the material is a bit more physiological in that regard. Typically, the pump should not which sits in the scrotum, should not really be that visible to anyone visually. As Dr. Perito was saying, if you're at a dedicated centre for implant surgery, most surgeons would aim to make the pump not very visible, have it sit in the scrotum, perhaps an impression of a little bit of fullness, but not really visible. So I think the answer to all of that is it'll look like a great erection when it's inflated, although the head will not be filled. It'll look a little fuller than it used to when it's deflated, but realistically not that visible to anyone else.
Thanks, Dr. Love. Dr. Hamdan, are there any concerns about penile implants interfering with urination or other bodily functions?
Well, the short answer is no. The long answer is, with penile prosthesis, it will not interfere with the urination. Okay, it's, the urination comes in a different area from where we put the penile prosthesis. We usually put the penile implant in something called the cavernosa of the penis, and it's a little bit away from the urethra. So, or where do people urinate from? So it does not affect the urination. But for sure, before the surgery, we would like to check the prostate size of the penis, make sure that he will urinate well before the surgery. So after the surgery, he will not have any problem. Other than that, it will not affect the urination. And I don't think it will affect anything in the patient's body, especially the inflatable prosthesis. It's mimic the physiology of the normal erection. So it will not interfere with any of that things.
Thanks, Dr. Hamdan. Dr. Perito, what is the typical lifespan of a penile implant, and how likely is it that a patient will need revision surgery?
That's a great question, because I'm sure that everybody on this Zoom is seeing younger and younger men in their office. And the younger men, they're doing their research and they're reading the Mayo Clinic experience of revision surgery, which the infection rates can be terrifying as you go, up the line after 1, 2, 3 revisions. In general, all implants, all 3 companies, we don't have long-term data yet with Rigicon, but by design, it should be similar to the other 2 companies. You're looking at a 1% to 2% failure rate per year. Now that blows away orthopedic implants, right? But because it's a penis, it's a big deal when one breaks. It's not a big deal if it was put in by somebody who's accomplished, because your chance of having these infections that Mayo Clinic reports is grossly diminished because of something that, it's called biofilm, but that's beyond the scope of talking to patients until you got them in your office. But when young guys, they need to ask, what do you know about implant A, B, or C? As far as longevity, it should be 1% to 2% per year, somewhere between 15-year survival, somewhere between 60 and 75%. And if it's done well, the revision is not going to be, if it's done well the first time, revision is going to be a piece of cake. And it's just like, like I said, our 0 mile patient who went from, a 4-cylinder to a V8 Windsor. So it's an important question, especially for young patients to ask. And again, in the hands of dedicated urologists, you're not going to have to worry about the infections that may increase with revision surgery.
Thank you. Thank you, doctors, for your insightful answers. Before we conclude, is there anything else you would like to add about penile implants, or any advice for patients considering this option?
Yes. Dr. Hamdan's description of length and girth before or after a penile implant is spot on. All I want to do is emphasize that penile implants don't make a penis shorter. The only thing that makes a penis shorter is erectile dysfunction. And if you're watching this, you probably have erectile dysfunction and you are experiencing atrophy as you speak. You need to understand the only thing that stops atrophy of a penis is not shots, it's not pills, it's not a vacuum device. The only thing is a penile implant. And once it's in place, as Dr. Hamdan eloquently described, there is expansion with the penile implant. We're not selling a bigger, fatter penis, but expansion occurs. So if you want to recognize your penis, get it done sooner rather than later. That's what I would add.
If I could just add something to that as well, I think the length issue and the girth issue, a lot of it is about explaining to patients. As Dr. Perito said, they lose penile tissue, they lose length when they have erectile dysfunction. And it's very important, in whatever way you need to, you explain that to the patients. When we put penile implants in, they do act as a tissue expansion device. And the newer implants, Rigicon, for instance, have very good girth now. They can expand to 23, 24 millimeters. So if the patients natural tissues allow expansion over time, the device will act as a tissue expander. Even length, which is the patient's major concern usually, implants, even a non-lengthening implant, will usually allow the penis to lengthen a little bit over time. But it's really about explaining to patients beforehand that they have lost length. An implant is not going to lose more length. In fact, if it's done correctly, they should have good length and may indeed get some expansion over time. But we can't promise that. It's about really telling the patient you're returning to function. You've got an unfunctional penis now. We can make it functional. And I think Dr. Hamdan said earlier that these patients are very happy. And the one thing I think we haven't necessarily discussed today is what it does to their mental state. And, these guys lose their sense of manliness. They lose self-esteem. They lose confidence. And to see them feel better about themselves as a man and be able to function is a really gratifying part of doing penile implants for men. So apart from the physical stuff and all being able to have sex and all the great stuff an implant does, these guys feel better about themselves, and that's a really good outcome too.
Excellent.
Thanks. Any other questions that need a second opinion?
Probably not. I think I think the answers have been. Do you think, guys, that the answers have been pretty reasonable?
I think they're great.
Yeah, sure.
Yeah. I mean, we can talk about a lot more stuff for a lot longer, Desi, and you can get us arguing and all that, but that's not what you want to see.
I don't think we argue about anything, Chris.
No. Paul and I did a podcast when he was in Melbourne last year, and to get 10 minutes of podcast, it took us an hour because of all the profanity we had to edit out. No, not true, Paul. Not true.
I didn't use any profanity, if I remember correctly.
That's right. We just talked for an hour, and it was a great podcast because it was two guys that do implants just talking and comparing ideas. But that's not exactly what you want. This has to be a bit more regimented and structured for patients or potential patients looking at it. So, yeah,
I think it's cool. We got Australia, Jordan, US.
Yeah,
that's really cool.
Yeah, absolutely.
Yeah.
Do you think we've answered everything, Desi, that you want?
I think so, and I think it's a great start to Rigicon Talks, and there'll be opportunity for more sessions, of course, because Rigicon Talk is an ongoing series. So we can expand on that, moving down the track. So it's not something Rigicon intends on stopping in 6 months' time.
Sure.
I like the neon. You see the neon that they use?
Yeah.
It looks like a strip club. It looks like I'm going to a strip club. It's fucking awesome.
It's very good.
All right. Thank you to our esteemed panel for sharing their expertise on this important topic. This session has provided valuable insights into the world of penile implants and their role in improving patients' lives. Thank you to our audience for tuning in. Until next time, stay informed and take care.